respiratory. Hi, my name is Amy and I'm a respiratory care student with the respiratory care department. Today I'm here to draw some blood, okay? And this one is called an ABG draw, and that is taking it from your artery, and I'll be taking it from your wrist, okay? And if that's all right with you today. All right, and so I'm just gonna check your ID band to make sure it matches with my documents. So I check that, and I'm gonna assess the patient, to check their vital signs, get it before and then after. All right, so once you're all ready, all right, so I'm gonna have you extend your arm, okay, across here. This is our table, and so we're gonna have it go across, and I would set like a pillow or some kind of towel, something bundled up underneath just to hold their wrist out so I can get their pulse here. All right, so when I have the patient go right here, I need to do the Allen's test, so I'm gonna hold both radial and ulnar, and I'm gonna have them do a fist 3 times, and I'm gonna do the modified Allen's test just to see how long it takes for their skin color to come back. And it needs to come back 3 to 5 seconds. And then if it doesn't, then I have to check the other one and see if it has good flow in that one. Same thing, I would hold down the radial and ulnar, and then I have them do the fist 3 times and make sure, and then I'd release the ulnar to see if I get the right pulse, okay? All right, so here I have my kit, the arterial blood gas sampling kit here, and this is just to see your oxygen levels, okay? All right, so I have my syringe here, and I have my alcohol prep wipe, and all the necessary things that I'll need to perform this. So I'm always gonna make sure my hands are washed and clean, and I'm also gonna wear the proper gloving because I don't wanna get stabbed or accidentally have their blood on my hands or anything. So once I find, so I'm gonna make sure before, like my site, like right here is my site, and so I'm gonna go in a circular motion around with the alcohol prep wipe around it, okay? And to make sure it is sterile and clean. I don't want anything infecting it, and I want to make sure I have a Band-Aid ready and the gauze to hold on to it. So when I'm ready, I'm gonna make sure I have this at a 45-degree angle, okay? And I find the pulse, and I'm gonna go like a pencil into there. And I'm gonna make sure the bevel is sitting up because I don't want it down because it's not gonna get it like it's supposed to. So I'm gonna go in, and you'll notice it'll start filling up to the appropriate line that you need it at. And then here I have a stopper. So when I go to, after I'm done, I can push that in there, and I'll dispose of the needle. Once I dispose of the needle, I will put this little cap on, and then I'll make sure there's no air bubbles or anything in the needle, no clots or anything. And I will make sure their label has been properly filled out. I'll have their patient's name, their room number, date, time, test was done, and I'll make sure I put, if they are on oxygen, I'll need to make sure they have their FiO2 down on there as well. And then I will safely put this needle into here, and I will put their label on here. Now after I had taken the blood, I need to hold the wound site here, and sometimes you may even have to go up to 15 minutes just depending on if they're on an anticoagulant or anything like that. Most of the time it'll take about 5 minutes just depending on how bad the patient is bleeding. And then I would put their Band-Aid on to make sure everything is okay. And I'd ask them to make sure they are all right. They don't feel like they're gonna faint or anything after I've drawn their blood. And so, are you okay today? All right, thank you so much. I'm just gonna reassess them, and I'm gonna wash my hands, make sure everything is sterile where I had taken the blood, and then I will take my blood sample to the lab.